People often ask, what is peripheral neuropathy, what causes it, and what can be done to restore the peripheral nerves to health. Hopefully, this following presentation will answer some of these questions. So this is a picture of a nerve, and some of you have had issues with conduction or compression. So basically, the axon is what allows communication of the nerves to go from one neuron to the next. The myelin sheath is the layer outside the nerve, which can be affected. So on your left-hand side, you can see what a normal nerve looks like. Some people have what they call focal compression, and this can be caused by trauma. It could be caused by repetitive stress. Sometimes we can have compression due to post-surgical problems. And these are more your focal mononeuropathy type issues. If you do have sheath loss, this is the myelin sheath, the lining of the nerve. The myelin, once it does deteriorate or degenerate, it does not grow back. Then you have issues where the nerve just does not communicate properly from one nerve to the next, so you get mixed signals. And probably the most common is just degeneration, which is a normal process of aging, but I do believe that it can be minimized and sometimes changed a little bit if this is the issue. So peripheral neuropathy is extremely common. It's estimated right now that about 20 million Americans suffer from this, and I actually believe this estimate is low because a lot of people that have it just don't go see their doctor, they just live with it. So in essence, it's when the electric wiring from the brain does not communicate properly to the hands, feet, or sometimes the different organs in our body. So by definition, peripheral means out from the center of the body, so away from the brain and spinal cord. Neuro means nerves, and pathy means abnormal, so it's abnormal nerve flow away from the brain and spinal cord. The major signs of neuropathy, and you can have some of these, all of these, one of these, can be numbness, burning feet, cramping, sharp electric pain, pain when walking, difficulty sleeping from leg discomfort, tingling feelings, loss of balance, weakness, and swelling. These are the most common signs, and there are other things that can happen also. So oftentimes people are like, they've heard words like small fiber neuropathy, large fiber neuropathy. So let me just describe what that means a little bit. So small fibers, which will cause a small fiber neuropathy, come from nerves that are called C fibers. These mainly deal with pain and temperature. So if you're having more issues with pain and or burning or cold, these are more the C fibers that are affected. So it's a small fiber neuropathy. The large fibers, which are sometimes called the large diameter afferents, deal with vibration and proprioception. So if you find yourself losing your balance, maybe have a vibration sense, you're bumping into things a little bit more commonly these are your large diameter afferent fibers that are affected. Now, some people can have a combination of both, and oftentimes with a degenerative type neuropathy, both nerve fibers are affected. So this is just what the nerves actually look like. So the A fibers are their large fibers on your left-hand side. Your C fibers are your small fibers that deal with the small fiber neuropathy and pain and temperature. This is just a little chart that just kind of goes over again, basically the small fiber neuropathy and large fiber. And so on the left-hand side, with small fiber, you're going to get loss of pain and temperature, but touch, vibration, and pressure will be normal. Reflexes are usually good and motor function is usually good. This will create some autonomic issues, so problems with different organs in your body or blood vessels, so circulation, sometimes bladder issues, and it could affect a lot of the different organs. Normally when they do studies like EMGs and nerve conduction studies, they're normal. However, with the skin biopsy test will actually show that there is a small fiber neuropathy issue. On the other side, the large fiber neuropathy, that affects the touch and vibration, and it will affect something called position sense. So you'll get more loss of balance. So I put down here sensory ataxia, which basically means your body sometimes just doesn't know where it is in space. So when you touch, you don't really feel your feet so well, or you're bumping into things. With large fiber, the pain and temperature pathways are preserved, so there's no issue there, unless you have a combined of the two, small and large fiber. And then when they do the electrodiagnostic testing, you will have a positive nerve conduction velocity test, which affecting whatever nerve that is affected from the neuropathy. So symptoms are dependent on what actual nerve is affected. We have different nerves in our body. We have sensory nerves, which carry sensation, motor nerves, which control muscles, and then we have autonomic nerves, which actually carry information to the blood vessels. So if your sensory fibers are affected, it's going to create things like tingling, numbness, sometimes, again, balance issues, the sensory ataxia that I mentioned. And usually, for a lot of neuropathies, sensation changes often begin at the feet and then will progress towards the center of the body as the condition worsens. So, many of you know that the neuropathy is a progressive degenerative condition. And so through time, you're going to get other symptoms spreading throughout the body. Motor involvement will affect, more movement issues. So you can have cramping, you can have weakness, you can have difficulty like grabbing things, holding on to things, so more dexterity issues, and sometimes you'll even lose muscle bulk. Now, I think this is one of the most important slides of the whole lecture, and basically, what it basically says is any condition on that left-hand side, for it to become an issue, you have to have some metabolic imbalance as well as a neurological imbalance. So conditions, and it could be a little bit different for everybody what that condition is that creates that neuropathy. So it could be anemia, chronic inflammation. We're all well aware of the diabetes and the blood sugar issues. But it could be other things like autoimmunity, sometimes hidden gut infections, low oxygen, so hypoxia, anemia. These all can create peripheral neuropathy. And in turn, it will decrease the frequency of firing of the brain and the nervous system, creating fatigue and then degeneration of the brain. So unless these metabolic issues and or neurological issues or imbalances are addressed, the neuropathy is going to continue to progress. If you can find what that hidden cause is, then I think that the progression of this can be decreased and not really resolved, because they say there is no cure, but I have seen symptoms improve greatly by figuring out what the metabolic and or neurological imbalance is and then fixing that. So through other lectures that I'm going to give, I'm going to talk about certain conditions and things that I have found to support the neuropathy to help it improve, or at least make sure that it doesn't progress. So in my office, what I found is it's a combination of issues. So it could be 60% neurologic, 40% metabolic. The next person that comes in that I evaluate could be 80% metabolic, 20% neurologic. It all depends on the testing and the type of neuropathy that actually presents. So in one of my lectures soon, I'm going to go over, probably this coming week, how I evaluate a patient. So the test that I run to look for small and neurofiber neuropathy, besides the electrodiagnostics or the skin biopsy that you have possibly done through your neurologist. So what it comes down to is basically, the basic ingredients. We have to eat food. Our body needs to break this down, which means we have to have good absorption. And when we don't have good absorption, or if our body doesn't know how to break down proteins, fats, or carbohydrates properly, or if we're not eating the proper foods, we're going to have troubles converting that to energy. So energy is basically our fuel. So it's the glucose. And our most